to our next episode of Compliance Deconstructed. Elvan, Lorie, and I, my co-hosts, we're going to continue on with our conversation about fraud, waste, and abuse. I think actually we could probably talk about this forever, but we've got a really great show today, and we're going to talk with you about fraud and AI. We're going to talk a bit about prior authorizations and where this conversation about fraud fits in. And then we're going to talk a little bit about, we're going to push each other, challenge each other to answer the question, can fraud be prevented? Can it be totally prevented? And so we'll kick off this conversation. Elvan, do you want to kick us off with AI?
Absolutely. For some reason, me and Lorie ended up on the different sides of the spectrum on this one, which is probably, we don't have a lot of subjects where we don't agree exclusively with each other, but AI happens to be one of them. As you all know, I work for a company that utilizes AI heavily, Robotolife. And since the start of my employment with them, I went from skeptical to adopter to now almost an admirer. And it's hard for me to say this, but it is true. So let's talk a little bit about AI and fraud, waste, and abuse. And I want to talk specifically about fraud and artificial intelligence. Artificial intelligence has the ability to play a very good dual role in our compliance world. Why? It can be a tool, which we already know that Medicare contractors do use this, that it can be a tool for detecting and preventing fraud, right? But it can also become a tool for committing fraud. So it really is having that, I'm almost thinking like going back to my young age and the cartoon characters where angel and devil are, those little things are talking. And I'm seeing AI. I'm seeing AI as a tool for both of these options. So it's pretty significant because it has the potential of saving time, i.e., saving our resources in detecting and preventing fraud. While on the other hand, it also has the ability to create more on the back end for all of us to deal with. So it's going to be interesting conversation, I hope. And please stop me whenever my train leaves the station, makes it to the next station. But I'm really intrigued by this idea of how AI can be used to detect and prevent fraud. AI has the ability, we already know that artificial intelligence has the ability to detect different patterns, or it has a pattern recognition ability. And when you have a pattern recognition ability, you have an anomaly detection ability. So then we talk about this, then these manual reviews, out they go, because now we have this machine that says, okay, for this code, these are the expected behaviors. And when things fall outside of those expected behaviors, how much farther it falls outside of the expected behavior, then does it require human eye? Does it require further investigation, auditing, and so on and so forth? So that should be super helpful in streamlining our fraud prevention activities. AI also has the ability to analyze natural language processing. By that ability, it's able to look at the claims, documentation, and billing and analyze text in a way that finds inconsistencies that are not alike to what is normal for that, billing and documenting. And it's also able to find deceptive language. So again, that's another yes. So it's not going to only find the words that fall within a normal category that goes along with that, maybe code, that diagnosis, that age, everything that fits that picture, but it's also going to be able to find deceptive language. Is there a language that is being used that is meant to be deceptive? Sometimes in one of my investigations, I remember looking at documentation for a code that was built over and over again. And I mean, the descriptions were so amazing, but so amazing. And I'm thinking in my head, this poor clinician has done this 20 times that day. Unlikely. Just so very unlikely. It's supposed to be a 2-sentence documentation. Now we have 2-page, conglomeration. And I'm like, that didn't happen. Like, it was so out of the norm, right? But the machine is able to do that a lot faster than I can. So again, it has that ability to utilize that natural language processing skill to, detect and prevent fraud. And we already know it does the predictive analysis. It gives us the likeliness of per geography, per code, per reimbursement, per age, per diagnosis. It has that predictive analysis ability. Again, all of these things are awesome for AI to be utilized to detect and prevent fraud. There's some idea about using it in investigations. I'm not really sure, because I always
Okay.
think that investigation is such a human touch thing. I'm lukewarm about it. Lorie and I can share our lukewarmness on this one. But yeah, the other stuff is I think it's very exciting. Again, to me, I'm thinking I'm all about efficiency, and I'm like, okay, why do I have to employ 20 nurses to look at 2 cases when a machine can do this so much quicker and give me the analytics of what is, normal, what is not normal, what is the range that's falling outside of the norms. But then there's the other option of how AI can be used to commit fraud. So
Mm-hmm.
when we put in claims for services that were never rendered, and I have a machine in my hand that can populate documentation and billing practices, and you prompt that machine to do it at such variance that it mimics the variance and the stress level of a human. So now you're putting a machine against machine. So it has the ability to populate these claims and documentation that's going to mimic that, because that's how I'm prompting the machine. Therefore, I can create claims, false claims, that I can submit that makes it look like a human did it.
Well, not
So,
just that.
mhm.
I'd say the scope or how big the false claim issue is magnified now, right?
Oh,
So I'd add to
mm,
that.
mm,
So
mm,
not only, can you can program maybe AI to support false claims, but the magnitude, that's the word I'm looking for.
mhm,
The risk of the magnitude is so great.
mhm, mhm. And again, let's say that we have, for those who have listened our previous episodes, I have my common criminal that's now living in the back of my head. But my common criminal is so sophisticated that they're using AI. Not only they create these claims, but they put their own claims to the test. Now they're able to bypass, because
Mhm.
then they will say, okay, I'm going to create 10 false claims for submitting. I put my AI to test my claims. 2 of them are too obvious. I'm just going to pull those back. 8 still goes out. So now I'm
So those
created.
are,
Yeah. Yeah.
yeah,
So
those are some pretty big
AI and fraud
risks.
is a very, very interesting subject. And I know we touched this last time just a little bit about AI and where is the information stored, because it needs information. It's kind of like a self-feeding machine. And what's going to happen with that? I really am not sure. As a user, I'm concerned, but I'm so fascinated that I can't stop myself. So there we are.
Yeah, I think along with that, another concern that I think I have, putting aside environmental concerns, is
Oh,
the
I forgot about your
potential
environmental concerns.
is the potential for bias and discrimination, because this AI model has to learn from something. And if it's programmed in such a way, it could start profiling or only singling out a particular type of claim or type
Mm.
of member. So it's got a high potential of bias and discrimination that, again, I think it can be managed with a lot of oversight, but I think that is something that we have to think about. I definitely think about my environment. I think about, which you just brought up around the storage. Where is this privacy data, this member's PHI, super PHI, who's looking at it? Once it goes into that fraud scheme that you're building, and then what are we doing with it on the backside? Is there a way to de-identify that data set? But then the potential for bias and discrimination, I think those are obviously things I think about. And then making sure that we're being transparent. If the model has a misstep or starts profiling or starts discriminating, what are we doing to correct it? But let's talk about the fact that it is doing that we are course correcting. I think all of that in the spirit of transparency, not to say that it can't save a ton of time and potentially ferret through data a lot faster than one or two people could alone. I think it's definitely the balancing act.
Jess, I
And
have a
I,
question for
oh,
you.
go ahead.
I
Ask the
actually have
question.
a
Is
very
that for
specific
me?
question. Knowing
Okay.
Jess's background, without going into too much detail of her past experiences, if there was a product, AI product that was proposed to one of your previous EHR companies that you worked for, EMR companies, and they said, if you utilize this, you can run through all the claims that are put through and it will show you your risk areas.
What's the question? Would I adopt it?
Would you use it? What would be your first reaction?
Truth? I'd be pretty excited about it.
Truth, always the truth.
Truth, I'd be super excited about
Love
it.
it.
And, my first instinct would be, oh, how can we use this? Obviously, I'd have other questions
Yeah.
about the security, where it's pulling data from,
Mhm.
and I'd like to know more about the product. But in very general terms, yeah, I think it would be brilliant. When I think about how much effort goes into documentation review, and you're looking at quality programs, if
Mhm.
you're thinking
Mhm.
of a health plan or any kind of clinical organization, and they're looking through their quality programs, or doing documentation audits, documentation review, or they're doing risk adjustment, HEDIS, any of that kind of stuff. Actually, there's huge potential there. I mean, I personally think that there's a lot of opportunity for AI to help us reduce fraud, waste, and abuse.
Mhm.
And I think of that if I take a step back and I start even like in the clinician's office. I was speaking with one of the guys that's helping us produce this podcast. And we were talking about how going to the doctors for, let's say, your wellness visit, or
Mhm.
for a complaint, is changing now. Because I don't know if you know, and I never thought to ask, I found out about this by accident. I go to the doctors now, and actually, they're using AI as ambient technology. What do we mean by that? I'm talking to the doctor's talking to me, and they're no longer recording the notes. They're not taking notes anymore. The AI is listening in and taking notes of our conversation. Now, there are risks to that, right?
Mhm.
And the doctor at the end of the session has to review those notes.
Mhm.
Having this ambient technology doesn't negate the doctor's responsibility to make sure the notes are accurate. But what if they are more what if there's a lot more accuracy? Number one, it helps, that clinical provider really listen to the patient and provide, assuming
Mhm.
they're providing better care, right? There's potential there. But in terms of documentation and accuracy, and making sure that what that provider is billing for is accurately documented and
Mhm.
appropriately documented, actually, there's huge potential there. Think of all the audits you've done and the feedback you've had to give back of, yeah, you've made a claim, but your documentation doesn't support that claim.
Mhm.
And the
Mhm.
staff go, we're too busy. How much do you want us to write?
Mhm.
And so that there's real potential there. And in terms of doing investigations, I think there's always an opportunity
Mhm.
for humans. I don't think that goes away. But
Mm-mm.
in terms of data analytics, I think AI could help us. And now I don't necessarily agree with this. I actually have a real issue with it. But compliance hotlines being run by AI, I don't necessarily think that's a good thing. What I'm saying is there are some really creative opportunities to reduce fraud, risk, waste, and abuse. And I also think about AIs that you have all these proposed and final rules, right, that CMS is issuing. And the effort that it takes to read through those and digest them. Do I think that effort ever goes away? No. But where I think AI might have a role is to maybe summarize, clarify, act like an encyclopedia, and be able to provide some context so that people who are implementing these rules have a better understanding of what they're doing and they don't miss critical points, which is easy if you think about the Medicare physician fee schedule or the latest Medicare final rule. And you're like, oh my God. And the amount of resource and effort that goes into digesting these, let alone implementing them. So I think there are some very real risks around the use of AI and the impact on fraud. What really scares me is bad actors using AI to commit the fraud they would normally commit, but in more innovative ways, more sneakier ways, ways that have the magnitude of the impact is amplified way beyond what one individual might have been able to do beyond AI. And ditto with mistakes and errors. I think if the AI is getting it wrong, then there's a risk that that wrong will be amplified
Correct.
way more than it might have been under different circumstances. So the question then becomes, well, how do you identify it? And how can you keep up with an AI? Like, is there a way to keep up? And I don't know the answer, ladies. I know the tools that we've traditionally had, you audit, right? Assessment, monitoring. These are some of the tools, maybe proactive thinking about the risk and having your risk management plan. But even I don't know whether those tools will be able to help us keep up with potential fraud with the use of AI. Elvan, you're trying to say something. Please go for
No,
it.
all I'm thinking is, I'm going all futuristic in my mind, and it's just kind of like an escalation process. You put this machine against this machine, and then that one comes superior, and then you find that one to.
Well,
You know,
I
like
think
it was
this
just like a
leads us.
whack-a-mole.
It is a bit. It can be because there are so many opportunities, but I feel like those same opportunities come with risks as well,
Agreed.
and that needs to be analyzed. But that brings
Yes.
us quite nicely, I think. We were talking earlier about prior authorizations and fraud and what opportunities there are there. Lorie, there were some comments I think you wanted to make about the topic.
Yeah. So prior authorization, which is also known as pre-authorization, pre-certification, aka, and sometimes when it comes to pharmaceuticals, you could also have it called step therapy. But essentially, it's asking permission before you do a procedure or you send a medication through to a member. So a lot of companies have done this, and I would say it's most lines of business. I don't think it's heavy in one over another. I've seen it used in commercial, Medicare, Medicaid, ACA. I've seen it on limited basis in CHIP. Maybe CHIP is the one outlier, but most lines of business are leveraging some type of pre-certification, pre-authorization, just to say, hey. And it's really for the health plan to try and control some of that potential fraud or abuse, even where the practitioner wants to issue a therapy or a machine or a piece of machinery, a durable medical equipment or something like that. But in order for that to happen, they want to do a check, a sanity check almost. Unfortunately, practitioners and clinicians see this as overstep or overreach on the part of the health plan. The health plan says this is to help us control cost. So it's like this yo-yo on the scale, right? But if you think about this, if I think about Medicare Advantage and prior auth leverage, a recent study showed, and I'm looking at my notes, I'm full transparency, there was $35 million a year just in Medicare Advantage for high cost drugs with low utilization without prior authorization. So I think that's somewhat compelling, right? If you're thinking about a medication that costs $60,000 per dose, I think there's some sanity that needs applied. Is there a generic? Is there as an alternative? Is there something else that could be used? Does it always make sense? No. If you want to get an MRI, and I know, Elvan, they're near and dear to your heart, but sometimes an MRI is the best way to look at a knee or an ankle or a shin versus an X-ray, where the X-ray is only going to show you a bone.
Structural stuff,
But so I see the practitioners going, why do I have to get a prior auth for this? So I see both sides of it. I think there is some sanity to the use of prior authorizations. I don't think they're horrible, but you could convince me that they're horrible, that they are horrible at the same time, because I'm willing to see both sides. But I
Is
think
there a risk though, Lorie? Sorry, is there a risk though? And this still ties into fraud. Is it, and I've heard that this has happened, that organizations can sometimes they use prior authorizations to restrict access to care unnecessarily. And that's not allowed under the Medicare program. It's the no-go area. And yet organizations try to get away with it. So that's partly why prior auths have maybe gotten a bad rap. It's seen as a way of preventing people from getting legitimate care. Now, that's not always the case. In fact, most of the time, it's not. There's a genuine interest in making sure that money is well spent and that patients get the benefit of the money and the care that they're supposed to receive. But there are times, actually, when, or certainly the perception is, that care is being restricted for the benefit of the health plan.
Yeah. And I think you're calling out the right thing. And it goes as high as the AMA, the American Medical Association. They have called out and said, hey, we think there's an over control by pre-certification, prior auth, again, whatever term you want to use. I say prior auth a lot, but I live in Pennsylvania and the abbreviation for prior authorization is PA. So when you ask for a PA and PA, it gets a little confusing. So I tend to say the whole phrase. So I apologize for the overuse of words, but I just don't want to confuse anybody. But yeah, I agree with you, Jess. There are times where folks feel like the health plan is squeezing them to dissuade care or reduce cost. And there is a case to be made that prior auths can increase costs instead of controlling them, because it's time that clinicians and practitioners have to fill out paperwork. Now, I will say some states are starting to move to electronic only prior authorizations, where you have to go to a set portal and you have to submit it. It is required in at least one of the 50 states where the only way you can submit a prior authorization is electronic. So that means no more carrier pigeon, no more backs and napkins, no more phone calls, no more letters, any of that, only through a portal, which there's a case to be used to say, hey, that's great. That'll streamline cost. Now, on the other hand, the practitioner's like, well, I have to have an internet connection. I have to have time to sit at a computer or my iPad or whatever to submit that cost. So again, I feel like I'm talking out of both sides of my mouth, and I apologize, but I am trying to see both sides of the story.
No, that's part of the debate. That's the
Yeah.
really great thing, right?
Yeah.
We're supposed to be having a dynamic conversation and looking from the
Yeah.
different viewpoints. So it's fantastic.
And I think that's our proof that not certain things are not black and white.
Yeah.
Regulation may look like it, but
Yeah.
this is then there's the human variable, the human that's
The-
delivering the care, the human that's receiving the care.
The other case to be made is making sure that the person reviewing the prior authorization has the appropriate education, training, certification, whatever, to be knowledgeable to review that. There have been cases brought forward where some health insurance companies are using AI or using someone or
My
using
friend ChatGPT.
or using someone who doesn't have the appropriate background to reject or deny prior authorizations. And I think that is where it gets really problematic. So if you're having a peer-to-peer with Dr. Jessica and Dr. Elvan, and the two of you are having an educated conversation, and Dr. Jessica can make the case, and Dr. Elvan says, okay, I hear you, but, and you can have that dialogue. But very often we all know that that's not how the prior auth discussion goes until you get to the peer-to-peer. You have to start out with an appeal, and then a second appeal, and then a fair hearing, and then maybe you get a peer-to-peer. If you're lucky, you can ask for an expedited one that goes a little faster through the process. Again, some states have started to say, hey, we want this whole process to take X days, but not every state has done that. So it gets really problematic when you're seeing how many patients are the average doctor seeing in a day, 10 to 12 probably, right? Maybe more.
Right.
And if even 3 of them need a prior auth, okay, so 3 times 5 is 15. 15 times 4 is, I can't do math, but we'll say 60 a month times 12 months. That number gets really large, really quick.
Yeah.
And multiply that by the number of doctors across the country. This is a huge issue that could potentially just go south.
So I was wondering, I mean, as you were, I had, when we first started talking about prior auths, and we had just come off the back of a discussion about fraud and AI, I thought, oh, well, maybe there's potential for AI to kind of speed up the process of thinking about, reviewing these prior authorizations and just building in some additional efficiency if that's not just spewing garbage. But maybe there's a way of leveraging AI to make that whole process easier. But then you made a comment and actually suggest that some of that is already happening. AI is already being used in the prior auth process, but it's not necessarily effective. And that got me thinking, well, hold up, wait a minute. But why isn't it effective? What's going on? Is it just not AI and the review of prior authorizations? It really requires somebody to look at the request? Or is it there's nobody checking? There's an assumption that AI is going to do it all and you can remove the human. That's not going to work. Like even I can say that just doesn't work. But any insight into what the issue is going on with those AIs and the prior authorizations?
I think in the effort to speed up the processing time, I think it's making sure that they're looking at the right keywords where they're using AI. So if it's for step therapy and they want to make sure that the patient has used X, Y, and Z medication before they move on to this one, did they program them all in? If the member needs an MRI, did they already have an X-ray? Is that clear in the guidelines of what's required? And I think there is sometimes and frequently a disconnect between what we say is required and what the AI understands to be required. And as it's learning, maybe it makes some intuitive leaps that end up to be, a cannonball instead of a graceful
Yes.
ta-da.
I would agree.
So that sort of thing.
I'd
So
agree.
when I was thinking in our previous episode, or maybe 2 episodes ago, we talked about the current administration's kind of evolving definition of fraud.
Mhm.
So even here where we have an example of prior authorization processes maybe not working or AI being used, like maybe in the past, I don't know if that would have come under fraud, but something to think about going forward now and in the near future, like would that kind of broken system actually would it actually be considered fraud? Would it fall into this idea when you're having the definition of fraud pushed to become more encompassing? And you say, well, it's not just about false claims, it can now apply to other aspects of your government contract and other activities. You said you have a prior
Mhm.
authorization process and you said it worked and it's effective and actually now it doesn't and people aren't
Now it
getting
looks
the care that they
wasteful.
need. Yes, it's failing in some way. Is
Mhm.
that now fraud? And again, another one of those where I don't have an answer, but it's something that I think many of us in the compliance community are a little bit worried about. We don't know. This is something that time is going to tell. But when I think about what the reps from the OIG were saying, I think to myself, yeah, I'm a little worried. And prior auths has been a really big topic for a long time in the healthcare compliance space and really has blown up recently because people are feeling the pressure, right? Members, patients, whatever you want to call it, but the public is really feeling quite pressured and there's a lot of grievance around this process. And I wonder if this is another risk area where fraud might come, this term fraud, we might hear about it again in
Hmm.
terms of this process.
Yeah,
Absolutely.
and looking at your denial rates, but more importantly, making sure that when you're using AI, having that great oversight to look at what your AI is doing and course correct. I think there's absolutely, uh, you know, contrary to what Elvin thinks, there's an opportunity where I do think AI can really help
Yeah.
and make things better and
Mhm.
lighten the load for the folks that are working through fraud, waste, and abuse cases. I think as long as you've got great oversight to stop and say, okay, oh, we had 300 prior auths submitted, but we rejected 298. Maybe something's wrong here.
Mhm.
And having a conversation. So I think, if it's doing great work, let it do its great work. But if things don't smell great, I think you need to do that sniff test and say, hold on, what's going on?
Mhm.
Oh, we said if prior auths are submitted before 3 o'clock, reject, after 3 o'clock, accept. Oh, maybe we need to tweak that. So I just think it's a lot of sanity checking and, trust but verify,
Mhm.
Jessica. Trust
That's
but
right.
verify.
Absolutely.
You got to do
Absolutely.
your sniff test to see if it smells all right. But I think that's where a lot of organizations fail. They're not doing that kind of quick test. And we can talk about this all day, and I'm sure we'll cover it in another episode, why some of these tests don't get done. Yeah, no, I agree. I think there's a lot of opportunity and a lot of risk. It requires some careful thinking and planning.
Mhm. And again, we can't take the human variable out of it, right? One of my
No.
past positions, I used to say this over and over again, and it still stands true. AI will make mistakes. We will make mistakes. We're human, operating on humans. Variables are just so great. So when we try to reduce it to, like Lorie said, everything that comes before 3 a.m. with this diagnosis code gets passed and the rest don't get passed till 5 p.m. and after 6, it don't work that way. And I think that's why it's a tool. It can be a useful tool, but it can be a dangerous tool. So it's just, again, how do we use it? We still hold the power. We still
We
hold the
do.
power.
But that brings me to a question, ladies. As compliance professionals, as compliance officers, do you think we can eliminate fraud altogether? Like, is that our job even?
Do you want a two-step answer? I should answer like Jess, truth? Do you want the truth?
Well, I want to hear your thoughts. So, what's on your mind? I mean,
We're both shaking. No, I think because a part of it, when we use the word fraud, as we explained it a few episodes back, there's an intent there. Intent is human. Poor intent will exist despite all regulation and control. Human nature. It's unfortunate, but it's there. And every fairy tale needs opponent, an evil and a good.
I love her. I'm sorry.
You just need
I
it. You
love
just
her.
need it. We need it in life, and we know we need it. And I think,
You
and
need
I
a
think
little
that's a part of
drama?
it. I think it goes to me. It goes back to a very philosophical question. How do you know you're good if you're that good if there's no evil?
Yeah, all right. You've gone off philosophical on us.
There you go. But I don't think so. I think you have the controls to protect.
Yeah.
Protect the user, i.e. the patient. Protect the user, the provider. Protect the entity. It is our job to protect the entities. I do think well within our scope. The rest, I do think we will always have exceptions.
Okay. Lorie?
I agree. I think we could not completely eliminate. I do think with robust education and oversight, we can reduce the amount, but eliminate completely, no. I think sometimes intent is so important, and we have folks that, despite all of our education, despite all of our reassurance and you'll be fine, there's still folks that are going to make that decision that wants to submit a claim to benefit other members with the excess funds, or they want to enrich themselves with the excess funds. They want to do things and they don't think they'll get caught. Oh, I'm a small practitioner. They won't come for me, surely. So I think, again, I think we can reduce. I don't think we can eliminate.
No. Instant
And
gratification is too good.
I would agree. I'd also say, I'd probably take it a step further. Maybe I'm cold-hearted, or maybe I'm wizened. I don't know. But I would say it's not my job. It is not my job to prevent fraud in your organization. I cannot, as your compliance professional, always prevent fraud. I can't guarantee that. What my job is to do is to help you analyze your risks and help you plan how to respond to those risks, monitor and address them.
Agreed.
And I'm thinking, I'm also thinking about CEOs or CFOs who, they're dealing with the money, and maybe you don't have the support from them that you would expect to support. I mean, I talk to people, other compliance officers in that space, unfortunately, all of the time. And I've been there myself where you don't have that support. Well, I can't prevent them necessarily from committing fraud. What can I do? I can advise them. I could tell them what the regulations, what the laws say. I can tell them the consequences. I can whistleblow, I suppose, if I, wanted to go that route. That's an obligation, right? But maybe I don't know they're doing it. So there is nothing I can necessarily whistleblow on or report on. But at the end of the day, it's everyone's responsibility to be aware of compliance and fraud and reporting it. It's not just my responsibility. Yes, do I have a responsibility? Yes, I do. Does it all sit with me? Absolutely not. Can I always prevent it? Hell no. I have to say, if someone wants to commit fraud, and your audit program may only go so far. I know of audit programs, it's based on a sample. You do a sample audit. Everything seemed fine in that sample audit. Unfortunately, in the next sample audit, something came up. You know, what are you going to do? You can't prevent all of it. And the best thing we can do as compliance professionals, and so that people who don't work in our field understand, we can't prevent every wrongdoing. I have a lot of people come up to me and say, why can't you change this? This doesn't work. Why don't you change it? But we can't. We're one piece of an organization, right? So you can identify risks, you can work through them, you can raise awareness, you can educate, you can have policies and procedures. And guess what? Things are still going to happen.
Agreed. 100%.
So we try our best, right? That's it. But it might not be 100% foolproof.
Yeah. And that's why compliance is everyone's job, not just our job.
Yay, a plug for compliance. See, those of you who aren't from this field, you've got some real gems coming at you. Trust but verify, and compliance is everyone's job. These are like mottos in the compliance space. Consider yourselves educated. You know something now that a lot of other people don't know. When it hits the compliance trivia, guess what? You're going to do really well. All right, ladies, I think it's time for us to wrap up and prepare for the next episode next time. Thank you for a really great conversation, ladies.
Thanks,
it
ladies.
was so much fun, a lot of great information. Hope people listening enjoyed it, and we'll see you next time.
Yep. Give us feedback. We're here to listen and improve.
Absolutely.
Thank you.
Thanks, everyone.
Well said. Take care,
Bye.
guys.
Bye-bye.